investigations, sophisticatedly higher investigations, you have to brought the patient to see. So it is very important to see or to know the C classification. In clinical aspect of C classification, we have C1 to C6 grade, in which C1 is telangiectasia, C2 is disease, varicose veins. By varicose veins, we mean dilated, tortuous, superficial veins of more than 3 millimeter in size.
More than 3 millimeter.
So C2 disease is varicose veins, C3 is edema, C4 is skin changes, and C5 is healed venous ulcer, and C6 is active venous ulcers. And in etiology, you want to know whether these varicose veins are congenitally present or they are primary or secondary varicosities. And in anatomy, you want to know the system involved, whether superficial or deep. And in pathophysiology, you want to know whether the pathophysiology is obstruction or it is reflux. So, after all the assessment of your patient, which came to your OPD with symptoms of leg due to veins, you took history, you did examination, you did all the investigations, and now is the time to sum up all the information which you gathered from that patient in this C classification. And here you can see C2, E, P, A, S, and P, R. That means superficial venous system varicosities secondary to reflux. So this code, if you write, you send your paper to America, UK, Canada, Australia, it is universally known that this patient is having venous symptoms, superficial venous systems, reflux, leading to varicose veins. Similarly, you can, whatever your information about the patient comes, it might be C4, it might be E secondary, it might be E obstruction. So all the aim so far was to reach to this point. History, examination, investigations, everything was to reach to this point. So once you have reached here, so what is logical next step? You have to give this patient something, some treatment. So for the treatment of superficial venous system, what European Society of Vascular Surgery guidelines, they suggest you have to treat all the symptomatic superficial venous system disease upfront. Once patient is symptomatic, he or she comes to you, you have to treat them. Only C3 disease, where is edema, you just have to probe the edema first for other causes of edema. And you have to rule out other causes of edema. And once they are settled and edema turns out to be venous, then you will treat that patient as well. Now, what are the interventions you can offer to this patient? There are surgeries which you all know, classical flush ligation, stripping, stab avulsions, and then for perforators, subfacial endoscopic perforator surgery. These all are radical measures. These are surgical procedures. Then comes thermal ablation. Now, thermal ablation is basically ablating or destroying the vein with heat. So in thermal ablation, we have radiofrequency ablation and endovenous laser treatment. In both the cases, heat is being used, only the source of heat is different. In radiofrequency ablation, source of heat is radiofrequency. It has separate generator. In endovenous laser, as the name tells, laser is the source of heat. And otherwise, complete